Welcome to the Deep Dive. We're the show that sorts through all the noise to bring you the insights that, well, really matter. And today, we're tackling something incredibly common, back pain. I mean, whether it's from overdoing it on the golf course, maybe a recent injury, or just that chronic ache that won't let up. If you're looking for relief, believe me, you're definitely not alone. So in this deep dive, we're going straight to an expert source. We've looked closely at the insights from Dr. Katsevman. He's a top spine surgeon. Specifically, we're digging into the medications he often recommends or prescribes. Our goal, to just cut through the confusion, give you a clearer picture of the options so you feel more empowered when you talk to your own doctor.
And that empowerment part is just so crucial because, when people hear back pain and spine surgeon, they often jump straight to thinking about surgery. But the truth is a lot of patients can get significant relief, sometimes complete relief, just from the right medications, things that target the pain, the inflammation. The real key, though, is understanding what medication works for which kind of pain and, when it's the best choice. That's the strategy we're unpacking today.
Exactly. So let's break down Dr. Katzemann's approach, starting with what he often considers sort of the first step, that foundational recommendation. Okay, so kicking things off with something most of us probably have at home, acetaminophen, Tylenol. Dr. Katzevman often points to this as a starting point. It seems basic, right? But he says it can be really effective, especially in certain cases. Why start there?
Yeah, it's a great question. It gets right to that idea of targeted treatment. See, acetaminophen works mostly in your brain. It kind of raises your pain threshold. So it changes how you perceive pain rather than fighting inflammation right at the source, like, say, in your back muscle itself. This makes it a really good first choice for people who maybe can't take anti-inflammatories. Maybe they have stomach problems like ulcers or kidney issues, things we'll talk about more with NSAIDs. Tylenol gives them a way to manage pain without those specific risks.
Okay, that makes sense. And safety is obviously key here. He mentions a specific limit up to 4,000 milligrams a day,
Right.
but crucially, divide it up, not all at once.
Absolutely crucial. And this leads to something really important, something people often miss. Your liver does the heavy lifting metabolizing acetaminophen. If you take too much, it can overwhelm the liver, seriously damage it.
Wow.
That's why Dr. Katzevman stresses avoiding mixing it with other meds that also have acetaminophen in them.
Because it hides in other things.
Exactly. So many over-the-counter cold and flu medicines, even some prescription painkillers, have it as an ingredient. You might not even realize it.
So you really have to read those labels carefully.
You absolutely do. It's surprisingly easy to accidentally take too much if you're not paying attention.
All right, so if Tylenol works more on pain perception, what about when inflammation is clearly the bigger problem? That burning, swelling feeling. That's where NSAIDs come in, right? Non-steroidal anti-inflammatory drugs designed for both pain and inflammation. Most of us know the ones you can just buy, like ibuprofen, Advil, Motrin, and naproxen, which is Allevier. They're medicine cabinet staples.
They are. And they're common for good reason. NSAIDs work by blocking specific enzymes. They're called SOCOX enzymes. These enzymes make chemicals called prostaglandins, which basically signal pain and ramp up inflammation. So NSAIDs block the enzymes, reduce the prostaglandins, and you get less pain and less swelling. Pretty effective. Now, besides the over-the-counter ones, Dr. Katzevman often uses prescription strength versions, too, like meloxicam, brand name Mobic, or celecoxib, which is Celebrex.
Are they just stronger versions? Or do they work differently?
Well, sometimes it's dosage, but sometimes it's about being more selective. Celebrex, for example, mainly targets one type of COX enzyme, COX2. For some patients, this can mean it's a bit easier on the stomach compared to older NSAIDs that block both COX-1 and 2OX2, so potentially fewer gastrointestinal side effects.
Interesting distinction. And Dr. Katzevman mentioned something about how to take them for the best effect, not just popping one when it hurts.
Right. He finds they often work better if you take them consistently for a few days, like on a schedule.
Rather than just as needed.
Exactly.
Yeah.
That consistent dosing helps really break that inflammatory cycle that's causing the pain. It lets the anti-inflammatory effect build up.
Got it.
But, and this is a big but you have to be cautious with NSAIDs, even the over-the-counter ones. If you have stomach issues already, like gastritis or a history of ulcers, or if you have kidney problems, you need to be really careful.
Because they can aggravate those conditions.
They definitely can. Long-term use or even short-term high doses can irritate the stomach lining, potentially cause ulcers, and even affect kidney function over time, especially risky for older folks or those with existing kidney disease.
So even though they're easy to get, you really need your doctor's okay, especially for regular use.
Absolutely. Professional guidance is key. It just shows how even common drugs have risks that aren't always obvious.
Okay, let's switch gears. What about that awful feeling when your back muscles just lock up, like a really intense, painful spasm? For that kind of thing, Dr. Katzman looks at muscle relaxants, right? He mentioned a few common ones: methocarbamol, which is Robaxin, tizanidine, or Xanaflex, and cyclobenzaprine, Flexeril.
hmm Those are the typical go-tos for calming down those spasming muscles. And here's a useful tip from his experience. Dr. Katsevman often prefers methocarbamol, the Robaxin.
Oh, why that one specifically?
His reason is that it works well on the spasms, gets the muscles to relax, but it tends to be less sedating, less likely to make you feel drowsy compared to some of the others, like Flexeril.
Ah, that's actually really important if you need to function during the day.
Exactly. Needing to drive or work or just stay alert, that lower sedation level can make a big difference. Some muscle relaxants can really knock you out.
Makes sense. And how are they usually taken? He mentioned bedtime.
Yeah, often prescribed for bedtime.
Ah.
Taking it then allows it to work overnight to ease that muscle tension. Plus, there's a nice side benefit. It can often help you sleep better. And let's face it, deep muscle spasms can make getting good sleep almost impossible.
For sure. Anything that helps with sleep when you're in pain is a bonus. All right, moving from muscles to something different. That really specific, sharp, almost electric pain that shoots down an arm or a leg. Sciatica is the common term for the leg version, right? But doctors call it radicular pain. It feels totally different from a muscle ache.
Totally different sensation, yeah. It usually means a nerve root coming out of the spine is getting pinched or irritated somehow.
So for that kind of pain, Dr. Katzevman uses different tools. He mentioned gabapentin, and pregabalin lyrica is the brand name for pregabalin.
Exactly. And this really highlights how different types of pain need different strategies. These aren't your standard painkillers. They work more on the nervous system itself. They help modulate certain signals, kind of calm down those hyperactive, irritated nerve fibers that are firing off those shooting, burning, or tingling pain signals.
So they're stabilizing the nerve.
In essence, yes. They're trying to quiet down that excessive nerve activity that causes radicular pain. It's not about reducing inflammation in the same way NSAIDs do. It's about settling the nerve communication.
And how does dosing work? Is it just take one and you're good?
No, it's usually more gradual than that. Doctors typically start patients on a pretty low dose.
Okay.
Then they slowly increase it over time based on how you respond, how much relief you get, and how well you tolerate it.
Why the slow approach?
Mainly to minimize potential side effects. Things like dizziness or drowsiness can happen, especially at first. Starting low and going slow lets your body adjust.
Finding that sweet spot for relief without too many side effects.
Precisely. It's a very personalized adjustment process.
Okay, last category. What about those times when things are just really bad? Like a sudden, intense flare-up where the inflammation feels overwhelming. For those situations, Dr. Katsevman sometimes uses short-term steroids. For that powerful anti-inflammatory punch, he gave methylprednisolone as an example, often given as a mid-roll dose pack. That's for acute situations, right? To calm things down fast.
Yes, exactly. Steroids are incredibly potent anti-inflammatories.
Yeah.
They can bring down severe inflammation very effectively, very quickly. But, and this is probably the most critical warning we'll discuss, they are absolutely not for everyone, and they're generally only for short-term use.
Okay, why the strong caution?
Well, a major concern is blood sugar. Steroids can significantly raise blood sugar levels.
Ah.
So for someone with diabetes, especially if it's not well controlled, taking steroids can be really risky. It can send their sugar levels soaring.
Wow, okay, so that's a huge factor.
Huge. It really shows how treatments can affect the whole body, not just the area you're targeting. Even though you're taking it for back inflammation, it impacts your metabolic system. That's why a thorough medical history and close monitoring by a doctor are non-negotiable with steroids.
And why they're usually given in those taper packs, where the dose decreases over several days.
Exactly. That tapering schedule helps minimize side effects and reduces the risk of the inflammation flaring back up when you stop the medication suddenly. It lets your body readjust. Hashtag tag outro.
All right, so we've really covered a lot of ground here. A deep dive into the different medications a spine surgeon like Dr. Katsevman might use for back pain. We went from the basic Tylenol through NSAIDs, muscle relaxants, those specific nerve pain meds, and finally, the short-term steroids for flare-ups.
Yeah.
It's definitely not a one-size-fits-all situation.
Not at all. And that's honestly the biggest takeaway. Different kinds of back pain need different treatments. The absolute key, like we've discussed, is figuring out the source of the pain. Is it muscle? Is it inflammation? Is it a nerve? Maybe a mix. And then you match the medication or combination of treatments to that specific cause. That personalized approach is just essential for getting real relief.
Yeah, it really is. And it sounds like the right medication, when used correctly under a doctor's care, can truly make a massive difference for people. Not just less pain, but better function, better quality of life.
Oh, absolutely. But it's also good to remember, like Dr. Katsevman would emphasize, that medication is often just one part of the picture. Many patients also need things like physical therapy,
Hmm.
exercises to strengthen the back and improve movement,
Right.
or maybe pain management injections for targeted relief, lifestyle changes like weight management or ergonomics. And only in some rarer cases is surgery the answer. It's usually a combined approach.
A holistic view makes sense. So, thinking about all this, what does it mean for you, the listener, navigating your own health? Given how varied back pain can be and how specific these treatments are, how can this understanding maybe help you ask better questions next time you talk to your doctor? Maybe help you describe your pain more clearly and really push for that personalized care that targets your specific issue. Something to think about as you move forward, armed with this new knowledge.